And we're back with Steph Mundt for episode 2. You came on a few months ago at this point. For people who haven't listened, Steph came on to talk about all things bone stress injuries for episode 168, high versus low risk bone stress injuries. If people haven't listened, they should. And we're talking about somewhat of a similar topic today, but your own personal experience with things you've had to manage over the past few years or maybe decade. We're going to dive into it. But Steph, for people who may not have listened to that first episode and aren't familiar with you, can you tell the people about yourself?
Yeah, so my name's Steph Mundt. I'm a physical therapist and running coach located in Phoenix, Arizona. I work with athletes across the country for coaching and virtual rehab consults as well. And today I think we'll kind of get into what pushed me to become more interested in the topic of bone stress injuries and bone health. But just really passionate about helping women, especially men too. I think we're seeing more bone stress injuries and more disordered eating in men as well, or boys recently. But just really excited about helping people feel empowered in their bodies and understand that there's not really maybe as many limitations to their resiliency as we were once told, or as we once.
Yeah, I'm excited for this conversation. And it was sparked by just seeing a post of yours a few weeks ago, kind of sharing the trend of your improvement of your bone health, essentially you having osteoporosis at some point in your life and getting into osteopenia and now back into kind of a normal range. And I thought it'd be a great conversation for someone that has experienced it themselves, work with individuals who go through it, and are also, working on your PhD on a similar area. So I'll let you start wherever you'd like, maybe, where and when you were in your life when you had that initial osteoporosis kind of diagnosis.
Yeah, absolutely. So first, I think I mentioned this before a little bit just in my kind of introduction, but we will be discussing eating disorders, or I will be talking about mine a little bit. So just for anyone who's listening, it'll be recovery focused. We'll be very intentional about language, but I just want to make sure that that is acknowledged and out there for anyone who might be in a place that this would be hard to listen to. So starting with when I found out my bone health was pretty poor, it was my sophomore year of college. And so I actually had 5 bone stress injuries in 3 years at that point. And interestingly, I didn't get a referral for DEXA from the doctors at my college. It was an outside doctor who brought it up. And I think the last 10 years, we've really had more research on this. And so at the time, they just didn't have a protocol for kind of what to do in this situation. But at the time, since I had so many bone stress injuries, I was referred for a DEXA, and my lumbar spine Z-score was negative 2.5, which is in the osteoporosis category. And at that point, there wasn't really a plan. It was kind of like, here's this number. It's pretty bad. Good luck. So I don't think I really understood the gravity of it at that time. And looking back now in a recovered space, it may have not been explained to me, or I may just have been sick enough that it didn't really register with me. And so at that point, though, it was kind of like, here's some information, you're probably going to get more bone stress injuries. This is really bad, but there's not much that we can do to help you. And so then I just kind of stuck it in a drawer. We got paper printouts at that point, stuck it in a drawer, and continued about my maladaptive ways. But at that point, I think since that number itself didn't really register with me, it was more of in my college career not being able to run that got me thinking about the need to actually invest in recovery. And so it, again, at the time, it didn't really hit me. But a few years later, after I had been recovered and then moved into an osteopenia state, then it kind of registered with how cool it was that my bones were able to improve due to recovering from the eating disorder.
Yeah. So the 5 bone stress injuries that you had you said 3 years. Can you just touch on what those 5 were?
Yeah. So my first one was my cuboid. That was my very first one. Very interesting. I have not had a foot one since. So the first one was cuboid. Then I had femoral shaft. And then I had femoral neck. and then I had tibia, proximal tibia, and then I had the opposite femoral neck. So at that point, when I finally had a DEXA, I had two, well, really three. Cuboid tarsals are trabecular rich, but three trabecular rich sites. And typically now, if you've had one bone stress injury in a trabecular rich site, it's a good idea to get a DEXA scan. But at the time, again, I think it was just not commonplace to order those for athletes who were younger. One of the hardest things I think early on was sitting in the room waiting to get my DEXA and just thinking like, I am the youngest person here by so many years. People would make comments, the people doing the DEXA scan, like, oh, you're too young to be here. And so that was a really interesting experience to kind of feel like, I guess the really fragile at that point.
Yeah, and you said that osteoporosis diagnosis wasn't really described to you and outlined as to what this means, the severity of it, and maybe what to do moving forward. But it sounds like for you, it was the limitation of running maybe at your peak or running at all collegiately that was kind of the ignition to start to figure out what was going on. Is that kind of how it went?
Absolutely. Yeah. So really the reason that my bone health was so poor was primary amenorrhea because of an eating disorder. So that means that I had not started a menstrual cycle and by the time I went to college, and it was never addressed in high school. At the time I was seeing a doctor for my eating disorder, but it wasn't really seen as abnormal, I think, because I was a runner. And so by the time I got to college, they decided to put me on oral birth control to kind of jumpstart a period. And at the time, it seemed to make sense to me. I wanted to do anything I could to run because they wouldn't let me run until I was a certain predetermined weight. And so I did that. But later it became clear that that was kind of it gave us a false sense of normalcy because then I did have regular cycles, but we still hadn't addressed the root cause of my poor bone health.
Yeah. And then you figure out that you have osteoporosis. You're starting the process of figuring out how to get yourself out of this hole from that or from just minimizing the likelihood of future bone stress injuries. Where did you start? Did you seek out help? Did you just start researching on your own? What was that whole process like?
Yeah, I did. And I think this has become an important thing too. I'm not working in the college space right now, but I think that it is getting better from what I've heard. But I did have to seek out help from outside sources. So I got to the point where I wasn't able to gain the weight that I needed to recover on my own. And so I went to intensive outpatient therapy while I was in school. And then I was able to kind of get over this hump, I think, of just kind of get it plateauing, losing weight again or being unhealthy again, and was able to get to a gray area, I like to call it. I wasn't really recovered, I don't think, but I was recovered enough at that point that I was able to run. But the weight that I gained, then in my mind, I think it contributed to my improvement in bone density 2 years later, because during that time I was still on oral birth control. But my timeline is really interesting because we have some data from a year where I hadn't gained weight, but I was on oral birth control and there was no change in my bone density. But once I gained weight and the other variables stayed the same, that's what facilitated my movement from osteoporosis to osteopenia. Now, there were simultaneously some changes in training as well, which we'll probably talk about. But I think it was really the weight restoration. And I, again, don't have data on resumption of a normal menstrual cycle at that point because I was still on birth control, but it seems like the weight gain was the big factor that led to that change in bone health. And it turns out that research supports that as well.
That weight gain process, was that guided on the structure in a formal manner, or was it you kind of figuring it out on your own, or that was part of that initial kind of outpatient intensive care? They were giving you the tools necessary to do that moving forward?
That was a big part of intensive outpatient treatment. And then after I was done with that, I was able to follow up with outpatient therapy pretty regularly. And so exactly what you said, giving the tools, continuing to work through my relationship with food and exercise, it continued to improve that.
And I don't think you directly mentioned it, but were you a collegiate runner that was on an NCAA scholarship, or you were running recreationally? What did that look like?
Yeah, so I went to Arizona State University. I was a pretty high level runner in high school, and I think I started struggling with restrictive eating and exercise dependence. And initially, it was kind of fueled by this improvement in my times. And that's something that I think we do see a lot of, which is really hard because oftentimes you do perform better initially. And then you kind of get yourself in this hole where you're spiraling like, okay, this is good, and getting validation from running faster, from people telling you how good you are at this sport, right? And then it works until your bones start breaking or other injuries happen. And so um, I had my first stress fracture my senior year of high school. So by that time, I had actually already committed to Arizona State. And, I had all these hopes to run fast in college, but ended up having multiple stress fractures and in eating disorder recovery instead.
Recently, a few months ago, read Good for a Girl. I'm assuming you've heard of it and or read it
Yeah.
by Lauren Fleshman. And that,
Yeah.
for people who haven't read it, I heard Rich Willie recommended on a podcast a few months prior, and I bought it and I read it. And I'm sure outlines maybe somewhat of a similar path of what you went through and a lot of other individuals go through in high school and college, track and field and other sports, cross country, where they think that the weight loss or restrictive eating is the best case scenario or best option for performance, and that spiral of negative impacts. And then how, at least at that point when she was going through it, it just wasn't talked about. There weren't resources, and there were probably a lot of other individuals on her team that were dealing with it as well, but it was this kind of unspoken thing. Do you have any thoughts about that book, or have you read it?
It's on my list. I have it on my bookshelf. I'm really excited to read it though. So it's really cool to hear about some of those kind of parallels or similar themes that she experienced. And she's such an incredible advocate for the sport and for women in the sport.
Yeah, I'm sure you would really enjoy it, but I thought it was a great book for someone who doesn't have a great like perspective and lens in that area and no personal experience. So for people who want to read it, I would highly recommend it. I'll put it in the notes or the um show notes. So that process you started, what did kind of the first few months or year or two look like as you were that initial DEXA scan into, it sounded like 2 years out, you had the findings of osteopenia for the repeat DEXA. What, outside of kind of increasing nutrition and increasing calories and gaining weight, what from a training perspective and other life perspective did you start to feel like you needed or did adjust?
Yeah, I think training really changed. I think I went through two kind of, I don't know if we'd call these crises, but like aha moments, I guess. The first one was at that point when I did realize that running was going to be taken away if I didn't invest in recovering. And then I did change my training at that point as well. This was really more self guided. So I used to run pretty hard most of the time. I think most runners, or a lot of us, tend to end up in this rating of perceived exertion or effort level of like 5 to 6 out of 10 most of the time. And bones don't respond as slowly, as gradually. They respond more significantly to intensity than to volume. So if you're a runner with poor bone health or someone with a history of bone stress injuries, intensity is often the thing that's going to create a little bit more of some more micro damage, more stress, and lead to injury. And so I really pulled back on that. I think theoretically, right, if my bones were healthy, I might be able to tolerate those demands. But, and I don't know if pulling back on that actually contributed to improved bone density, but I think it did help reduce my injury risk for that period of time. So pulling back a little bit on training, cutting out cross training, that was another thing that I did a ton of. And I think a lot of athletes with compulsive exercise tendencies do, especially if they can't run or if they're told only run this much, then they end up increasing their cross training to kind of make up for that time not spent exercising. And so all of those things, I think cutting back on intensity, probably the end result was just leading to higher energy availability, which allowed the improvement in the hormonal profile and allowed me to have more bone building rather than bone breakdown.
And throughout this process, when you entered college in high school or starting at Arizona State, were you in a resistance training program, or were they having you lift when you started as a freshman?
They had us lifting, but it wasn't it wasn't the same program as ball sport athletes. I remember doing bicep curl, runner arms, back extensions, which some of those are fine, but we did not do any heavy lifting. And so that's something that I also didn't really get into until after a few years after college. I started just playing around, not because I knew about the benefits to bone health, but started just playing around and diving into different types of exercise. I did CrossFit for a little bit and Orange Theory, which isn't really heavy lifting, but tried to find really, I think part of that was trying to find an athletic identity outside of running. And then the last couple of years, probably 5 or 6, is when I really got into doing my own heavy lifting in line with what some of the research shows improves bone density.
All those things, as you're kind of pulling those levers or adjusting them, if you can recall, do you remember like actual changes in your, energy levels and your attitude and just the day to day as you were eating more calories and gaining weight and having less training intensity? Do you remember any changes?
Absolutely. Yeah. It's interesting now to look back and feel like I was a different person. And I think part of that is true because a malnourished brain is not a brain that can be present. It's not a brain that can focus, constantly thinking about one or two things, very anxious. And I think I was diagnosed with depression and anxiety in high school. And looking back, that might have also just been malnourishment as well. I think there's definitely these things paired together. So I don't want to put it out there that people are being misdiagnosed, but I think we need to consider that low energy and malnourished brain does create anxiety and depression and all these other kind of comorbidities that come with this. So just in general, I feel like I'm able to put more energy towards others, be more present. Energy in general, I'm not, falling asleep. There was one time I recall I fell asleep standing up. It was in class. I had moved to the back because I was nodding off and I was leaning against a wall and actually fell asleep standing up. I used to fall asleep in the car a lot. So big changes in energy. Just, I think, big changes in my ability to function and socialize and enjoy the things that I'm doing. I also think I used to, because I was running hard so much and then just not feeling good, I used to dread some of my runs, but it was, compulsory. It felt like, oh, I have to do this run today. And I would wake up just really anxious about doing the run. And now it has become, that I think has been part of a evolution of my relationship with exercise as well. But now I look forward to running, or if it's a really bad day and I don't look forward to it, I can skip it. And so just in general, I think there's a significantly lower level of anxiety in my life.
That relationship to running, how I'm sure that was not an easy process to change that relationship, or I don't know if the right word's detached, but not to feel so anxious about having to do it, or this maybe neuroticism about it. What were the things that helped you change that relationship?
Therapy was very helpful. Highly recommend for anyone going through this. And I think I did need some time away from it. I was very stuck on this like loss of what I could have been in college. And so when I would get back into training, it felt like I'm getting old. I only have this much time left. I have to rush and show what I'm capable of. And that would lead to that boom bust cycle a lot of us are familiar with. You go really hard, you get injured, then you lose that consistency, and then you're just fighting to get back up, but your tolerance has decreased. And so I think taking a step back and realizing that I didn't need to compete and I did want this to be fun, allowed me to then kind of gradually get back into it in a way that felt more enjoyable and took some of the self-imposed pressure off of it. It took about 2 years where I didn't run very much.
Yeah. So that period, did you stop? You weren't on the team for ASU at that point.
So I did quit before my senior year. And so that was one of those years I wasn't running too much. And then one where I had graduated and I was just not even running recreationally.
Okay, got it. The 2-year DEXA scan osteopenia was found. At that point, were you expecting that? Did it mean much to you because you maybe had more information 2 years into going through that process? And then from there, when was the following DEXA scan after that?
So from 2010 to 2012, that was the one that went from osteoporosis to osteopenia. And that was a solid couple of years where I had gained weight, I had decreased my running. And I think at that time, I thought it was good. It was exciting. But again, I don't think I realized the gravity of it at that point either. And then I started getting them every 2 years after that. And so it stayed pretty consistent from 2012 to 2014. I probably missed a year in there because I lost track of time because I think I got on an odd year cycle but there was between then 2012 and 2020 was kind of the most significant jump. So we kind of saw it gradually, but between 2012 and 2020, then I went from in the negative ones to negative 0.4 and negative 0.7. So might be helpful if I also talk about what these Z-scores mean really quick. So DEXA scans give results in T-scores or Z-scores. And Z-scores are used for premenopausal women and children. So generally, if you're under 50, look at your Z-score. If you're over 50, you look at your T-score. Both of them, though, are referring to a standard deviation above or below, quote, average, which is 0. And so between 0 and negative 1.0 is considered normal. And anything above 0 is good. You're better than, quote, average, right? But 0 to negative 1 is considered normal. Negative 1 to negative 2.5 is an osteopenic range or osteopenia. And then negative 2.5 and below is considered osteoporosis. And so the closer you get to 0, you'd be great to be in the positives, but the closer you get to 0, if you're in the negatives, the better you are. And one thing that I think it's important for people to know, though, is that doctors may tell you that if you're higher than negative 2, you're normal, you're within the typical range for the general population. But if you're an endurance athlete, still being negative 1.5 or 2 deviations below the mean is too low. You're putting high demands on your bones when you're running long distances. You probably have low energy available a good portion of your training cycle. And so the International Olympic Committee and the American College of Sports Medicine have now said you should be higher than negative 1.0 if you're an endurance athlete. So if you're told that it's normal, but you look at the number and it's negative 1.5 or below, that might still be too low. And it'd be good to just continue to work on improving your bone density.
That 2012 to 2020, that was the biggest overall change. Obviously, that's a big span of time, that 8 years. What it sounded like around that time, you had also started maybe increasing some of the intensity or being more serious about resistance training. What other things do you feel like helped kind of continue to push that needle forward during that period?
Yeah, so that's what I'm glad you brought that up. So that is around somewhere in there is when I started doing more heavy resistance training. And in addition to that, I think just consistently having more years at a healthy weight, what I was able to improve that too. In that time span as well, I came off of birth control and did have a naturally occurring cycle. So that was another important thing for me to see, that I was getting enough energy available that I could have my own kind of natural menstrual cycle. And so just thinking of that sign that I was getting enough combined with, again, a little bit of reduced running training. I was pretty inconsistent with it. It'd be like, okay, I'm going to train for this race. And then I wouldn't be as fast as I wanted to be. So I wouldn't run the race. So still having a challenging time with my relationship with running, but started to get into more heavy lifting and just more and more time at an appropriate weight.
And then from 2020 till now, 2025, I'm assuming you've had a few more scans.
Yeah. But the most recent was just a couple months ago, and it was in the positives. So now I have zero point 0.4 and zero point 0.7 or somewhere around there. So this is the first time I've been over zero. And between 20 and 25, that's been definitely my healthiest relationship with both food and exercise. I mentioned earlier, I think I was quote recovered enough, but I still struggled with thinking that I needed to run a little bit more if I ate a little extra, or having more concern about how my body looked.
All right, we had a weird mishap. We're back. Steph, if you remember where we stopped, I'll let you rock and roll.
Yeah, so the change from osteopenia to normal bone density happened sometime between, or the 5 years, 2020 to 2025 for me. So that was age 29 to 34, which I don't know if I ever thought that it would be normal. I think I always thought it would be lower than, quote, typical. So that was really cool to see. And I think that can be attributed to, again, recovering from an eating disorder is the number one thing. Weight restoration is part of that, resuming a normal menstrual cycle, and then starting to do more intentional lifting for bone health in line with some of the research.
We don't, that can be its own episode in and of itself, but can you touch on what that actually looked like for you, that resistance training and maybe jumping piece?
Yeah, so you mentioned Rich Willie earlier, and I think he's been really instrumental in helping to emphasize that runners probably don't need to be in the gym for 45 minutes 3 times a week. And so reducing the amount of energy spent on lifting and doing the minimum effective dose has been the key. So heavy back squats, heavy deadlifts, some sort of plyometric, and a little bit of calf work. So my strength takes 10 to 15 minutes, 2 to 3 times a week, and it's very, very efficient. That's been from some of the research by Rich Willie, Stu Warden, and then I have a great coach, Renee Hodges, who has helped program that for me.
And I saw recently you just crushed a marathon, and that was a PR of yours, I believe.
It was, yeah, really
Yeah,
fun.
can you say what that time was? And then leading up to it, what were all those components that you feel like have made you continue to progress and improve your performance to this point?
Yeah, so the first thing I think, well, first it was 2:52, which was a 4-minute PR, and it was a flat course. The previous course I ran was downhill, so that felt like a really big jump. And I think the biggest thing was consistency. This is the first time that I've run for 2 years consistently without a stress fracture. And so that alone, I think, has been instrumental in improving performance because I haven't had to take those long breaks. And that kind of relates, that change relates back to that second aha moment that I had 2020, 2021, when I started working with Renee. Initially, I was running more than she was programming. I was, trying to do extra, running harder than the prescribed paces, and ended up with a bone stress injury while working with her. And I think it then required me to take a hard look at why I was still doing the things that I was doing. And she's been really, really helpful with that too. But we just really then scaled back, and I committed to running easy most of the time, limiting the intensity, and taking the zoomed out view. I think a lot of runners say that they want to be running in their 80s and 90s, but we may not act like it when we're out there running at a hard effort every single day, or under fueling either intentionally or unintentionally. Those few things plus the lifting, I think, have really kept me healthy.
I think I saw after that race, you had listed out some of the things that you've been doing with your coach. And um, I think you had said in there, like every fourth week was like either a deload week, or there's weeks where you maybe weren't even running. Can you touch on like maybe other things of how you've scaled back just the total volumes and intensities?
Yeah, absolutely. So we do a cutback or deload week about every fourth week, and typical recommendations are scaling back volume by 25 to 30%. We'll do up to 40%, which always feels like a lot, and I have a little bit of hesitation each time, but scaling back a little bit more with those deload weeks. And we've also done a 2 up, 1 down situation before, so we're doing more frequent deload weeks. And then every 12th week, what's called, I think this was coined by Stu Warden, a skeletal reset week, where there's no running, no plyometrics at all. And so I think it'd be cool to do more research on this. The study that Stu kind of took this from was based on rodents. And they actually did 5 weeks of rest, and their bone formation markers came up compared to the rodents who had no rest. And so even prolonged rest seems to help to an extent, but 5 weeks isn't feasible for runners who are trying to run fast. So his current recommendation was to kind of settle on 1 week, and that's been working really well for me. And I'm also more cognizant now of taking time off when something flares up. If there's a weird sensation in my hip, my brain goes straight to femoral neck stress fracture. And so instead of, testing it every day and pushing through it, I will take a week off, reevaluate, and then continue. I think, taking that perspective of a week off now is better than 6 weeks off if I push through this, has also really helped.
Yeah, the amount of BSIs you've had is not a little, and just this journey you've had, I'm sure has helped you a ton. Have the empathy and have the experience with working with patients and athletes going through it themselves. When you're working with an individual that's going through something similar, do you bring up your own personal experiences? Do you keep kind of a barrier of how you've gone through, whether it's the eating disorder or the osteoporosis or all of these recurrent, bone stress injuries? Do you utilize that to kind of help people relate to you, or you relate to them, or do you kind of keep that separate?
Yeah, that's a great question. And I think it's definitely dependent on the individual and kind of what they're sharing with me. I've spoken a lot about it on social media as well as I talk about it on my website. So I think a lot of times, if people have seen that, they'll seek me out and ask questions because they relate to a lot of what I've gone through. And for those who don't, sometimes I'll kind of just spring it in once in a while if they're having a hard time. I'll just kind of mention like, "Hey, I struggled with something similar, and here's where my bone health is now because of X, Y, and Z." And so I try to offer it up in tidbits where it feels appropriate if someone doesn't know coming in.
And that amount of change that you had from that initial DEXA to this most recent one this year, have you worked with anyone or seen anyone so far that has experienced that big of a change?
I haven't yet, but I haven't worked with anyone that long. That was 15 years. So I do have an athlete two athletes actually, who had scores in the osteoporotic range who have improved towards osteopenia, still having one in the osteoporotic range, but hip in the osteopenic range over 2 to 4 years for each of them. So I've seen some of those changes, but not yet. I'm hoping that we will start to see that with a few people. But a lot of athletes also don't have DEXA scans from a few years after they may have had amenorrhea, which has a huge impact on bone health. So that's something that I'm trying to expand access to as well. I'm able to order imaging now and order that here in Arizona, which has been a game changer because I think some PCPs are resistant to it, and I think it can just be a good piece of information, especially if someone has a history of eating disorder or amenorrhea, to kind of know where our starting point is.
Yeah, because it was such a long process. Does that also give maybe some confidence for some people that are trying to like really quickly change their bone health, and that example of yourself that it occurs, but it can be slow, but it can change dramatically over time? Does that also help, just you seeing that full span?
Yeah, yeah, absolutely. And I think too, though, with that, there was a time period where I was still engaging in kind of maladaptive patterns and behaviors, but I was in the osteopenic range. So in my head, I thought, well, my bones are healthier now. Why am I still getting injured? But I hadn't put all of it together. I was like, all right, you did some stuff, but maybe you didn't quite do enough, and you haven't changed this piece of this relationship. And so that's why you're still getting injured so frequently. So I think that's an important piece too. Like this is something that is going to take a lot of time. You still might get injured if you improve your bone health. So you need to kind of take the holistic view and really reflect on and examine all of your different habits that might be contributing to these increased or to a high recurrence rate of injury.
What, for the individual either going through some of these things themselves, or the clinician that is working with athletes or patients going through similar experiences you've had, what is the words of wisdom or recommendations you have just trying to help people manage these really tough scenarios?
I think first for clinicians, just recognizing and referring. There are quite a few screening tools out there. I've got a post about it from a few months ago that I can share the link to. But even just having some screening questions from a longer screen to kind of create a safe environment where then you can ask more questions or offer a referral. I think just knowing that is really important. I think one of the one of my core memories was going to a physical therapy clinic after my third bone stress injury, and I was given a heel lift and told my hip flexors were too tight when it was clear that that wasn't the rate limiter for me at that time. And so I think just expanding our awareness that this is the foundation of health, fueling, sleep, stress management. And so we need to be screening for those things before we're getting into kind of the nuts and bolts of mechanics or even strength. So clinicians, just make sure you're screening for this, having a referral network, and then educating. And I think as athletes or individuals who are going through this, the recovery piece is huge. I think the unintentional underfueling is rampant, and kind of the subculture of wellness and fitness, which is actually harmful. And so, really addressing and again, reflecting on your relationship with food, exercise, what it means to you, and starting to create a team who can help you have more adaptive habits around the sport is first and foremost.
Do you work currently with any collegiate runners and have been able to kind of hear their experience of trying to navigate similar things in now the 2025 setting of collegiate sports to know, like, are they getting more resources? Is this talked about more? Is it just as, if not more, of an issue? Do you have perspective on that?
Yeah, I have worked with and I'm working with a few college athletes. I think the education and the knowledge about relative energy deficiency in sport and restrictive eating is greater, but I'm not sure from their experiences if that is translating into more action, if that makes sense. So I think that's something that um, have been thinking about a lot. I think we have this knowledge, but is it being utilized in the way that's actually helpful to athletes? And part of that, what I've seen is the training load aspect and trying to individualize training. We don't have much research on that either of, what athletes can tolerate before they might be at higher risk for bone stress injury. It's so individual. But there have been a few athletes I've worked with where we've gotten to work with a registered dietitian, fueling's on point, and then the training load just spikes up. And that feels so out of their control. They want to, please the coach, and that's when another injury occurs. So I think the implementation on some parts of it is going well, but implementation from a training perspective could improve. And I think that the knowledge coaches are getting still needs to be more reinforced and then given kind of an action plan of how to best manage this.
Is there anything else you feel like we skipped over or you want to dive further into just about your whole experience from kind of beginning till where you're at today?
I just really appreciate you reaching out. I think there was a really positive response to my post, and so it was something that felt vulnerable but really important to share. And I think that in general, there's kind of a frailty narrative around osteoporosis, osteopenia, even in the postmenopausal population. Now there's research to support high intensity weightlifting for that population that's safe and effective. So I think it is just an important message to get out. Kind of my final statement that you can change your bone health even after age 30. You're not disintegrating rapidly, and there are things that you can do to feel empowered if this is happening to you.
I think that's a eloquent way to wrap things up. I will highly recommend people check out our previous conversation to hear more about the kind of nuts and bolts of like coming to a conclusion on whether or not there's suspicion around a bone stress injury, how to manage a low risk versus high risk. kind of giving more specific examples outside of your own kind of personal experience through managing your own just history of all of this. And then you also had a great conversation with Greg Lehman, his Movement Optimism podcast that I thought was awesome. I'll link that as well. But Steph, I appreciate you being so open and wanting to come on. And your Instagram as well does a great job, one, outlining and sharing your own experience, but then just like each post is gold with kind of specific sites and management and things to consider as a clinician. So yeah, I appreciate all the work you're doing. And you're still chipping away at the PhD, I'm assuming. How much longer do you have?
I am 3 more years.
Nice. It's a marathon.
It is. It is.
Pun intended, I guess. All right, Steph, we'll call it there. I appreciate your time. Have a good one.
Thank you so much.